Hi everyone, I'm Melissa Duran. Welcome to Trending Vegas. We're talking about the major trending stories you're seeing on your social media channels. I'm joined by a portion of our city's social media team, including Jennifer Davies and Jace Radke. And our special guest today is local social media influencer, Deja Austin. Thanks so much for being here.
Thank you for having me.
So I follow you on Instagram, and I really think that your story is unique. You mentioned in a post that you really just kind of got started on this platform in 2018, is that correct?
So it's more so being new to entrepreneurship, not so much social media, because I've been in like social media management and marketing for a while, but full-time entrepreneurship is new for me. So I'm sharing that journey with my followers and those who are interested on my social media pages.
So what exactly, when you say entrepreneurship, is this you guiding other people through entrepreneurship, or you yourself building your own brand and your own image?
Both, I guess.
Okay.
Because while I'm going through my journey of entrepreneurship, I'm realizing that especially in my age demographic, entrepreneurship is trending right now, which is awesome, right? But we want to make sure that they are understanding of the fact that there are certain tools that you should have to be successful, and that the journey is not by any means an easy one. There's definitely highs and lows to entrepreneurship. So
it's really interesting you're mentioning this because, you know, election year, everyone's wondering where the millennial mindset is and the generation underneath. How important is it to kind of describe what kind of work ethic you need to be an entrepreneur?
Very important, because I think for me, going from having a 9-to-5 to just working, you know, you realize that it really is a hustle. You are responsible for whether or not you're making money that day or not. And I would say it was definitely an adjustment for me to making sure that the same way that I'm working my butt off for a 9-to-5, another company that I'm working with is the same way I got to work my butt off for mine, if not more.
Absolutely. Well, we're glad you're joining us, and we wish you the best of luck with everything.
Thank you.
All right, guys, we have a lot to talk about today, but let's go ahead and start with the coronavirus. It is making itself seen across the world, and yet I really feel like there is not much we know about it. Here's a look at some of the social tweets we're seeing. This one is from the CDC. It says, while CDC considers COVID-19 a serious situation and is taking preparedness measures, the immediate risk in the U.S. is considered low. Everyone should always take simple daily precautions to help prevent the spread of respiratory illnesses. I do want to mention that we're taping this show, so this could change even the course of when this show airs. So then we have this one from the CDC. The CDC is working directly with state, local, and territorial health departments and governments to prepare for possible spread of the coronavirus in the U.S. Preparedness efforts are carefully coordinated with healthcare systems, clinicians, pharmacies, businesses, etc. We have this from CNN International. The executive director of the World Health Organization's Health Emergencies Program says it's too early to declare the novel coronavirus a pandemic, but added that we are in the phase of preparedness for a potential pandemic. I thought this was interesting because San Francisco came out and said, we're going to declare, their own emergency for, how they see fit. And I think San Diego, some other cities have done the same. We really haven't heard too much about what we should be doing aside from washing your hands, covering your mouth. Same thing that you would hear as the flu. Deja, let me start with you. What are you seeing on coronavirus? Are you concerned about this illness?
I think naturally I'm concerned just because I'm someone who overthinks situations. So in my head I'm thinking I need to make sure I'm doing everything that I need to do so that I don't catch the coronavirus. But I'm realizing that especially in my age demographic, because we're ones that gravitate to social media for, it's like the Bible to some of us.
Yeah.
But there's a lot of misunderstandings and things that people aren't aware of. So yeah.
Yeah, Jen, what are you saying?
Well, I think it's really cool. Shout out to the CDC. When you look at the coronavirus on Twitter, if you look up the keyword, Twitter suggests that you go follow the CDC official account. So they're trying to do what they can to stay ahead of the misinformation because it's rampant out there. I mean, we were looking at the feed earlier today and some guy had tweeted that he couldn't even buy bleach in Wisconsin. But it's so hard to know. Can you validate those photos? Is the information accurate?
Maybe they just forgot to order bleach.
Yeah, who really knows? That's the nature of social media. You don't know what the context of a particular photo was. So it's like anything else. It's flu season. Wash your hands anyway, because who wants to get stuck with the flu?
Yeah. I am concerned about coronavirus, but I think the fact that Clark County or Nevada has 0 cases so far, 0 confirmed reported cases that we know of. Right. I think that maybe I'm not at the level of, oh my gosh, what's happening? What do I do? But maybe I should be, and that's where I kind of sit am I not taking this serious enough? Am I Jace, you've been
I mean,
getting tons of phone calls.
Yeah, I get tons of phone calls. I mean, as the guy that is the first stop for the media at the city, we get a lot of calls. When the San Francisco mayor declared the state of emergency in San Francisco, even though they also have 0 reported cases,
Right.
I'll add. But that's his prerogative. He's the mayor. He can do what he wants in San Francisco. But we immediately got calls. Well, what is the city doing? What is Mayor Goodman doing? And the health district, the Southern Nevada Health District, is really the lead here in Southern Nevada, and the governments here are working closely with the health district and monitoring the situation. But when you say there's not a lot of information out there, I think the information is out there on the tips of what to do. Wash your hands, and that's not sexy information, and this is a mysterious virus from China, a place a lot of people haven't been. So I think, people are like, well, where's the information? Where's the information? But really, you just need to follow what the CDC is telling you.
I think it's interesting, though, that, you have San Francisco coming out saying state of emergency. So that causes panic. That causes people to think they're not telling us something. We're being kept in the dark about something. And I think when you have so many different cities and different even states on different pages of how they're reacting to this, it just lends itself to somebody could be hiding something. Okay. When in reality, it could be that someone's just overreacting and someone's underreacting.
Right.
And I think that's where I am with. I'm just really confused. The good news is that we do have a doctor on from the Southern Nevada Health District on later on in the show who thankfully comes and answers our questions about coronavirus. I know I have a lot of questions for him, so I guess we're just going to have to keep monitoring this, and same thing as we always say, be careful who your source is.
Look at your source. If something did happen in Southern Nevada, you can bet that the Southern Nevada Health District, the city, and the county would be putting out good information. It's kind of those people's jobs to let you know if there is a problem.
Right.
Yeah. And should you be planning for emergencies? Yes, but you should always be planning for emergencies, whether it's an earthquake or a virus or whatever it is. You should have emergency supplies at home. Think about how much water you need, non-perishable food items, what have you. It's always a smart idea to have those on hand.
And your prescription drugs. Don't forget your prescription
and
drugs, and for your pets.
Hair care products, or you don't have a bad hair day.
Oh my goodness, you stop. All right, guys, and also the CDC is a great social presence, right, like we talked about for this kind of
CDC Gov,
information.
that's their account pretty much on all platforms, so people can go follow them.
Okay. All right, look, guys, let's go on to our next topic. We have to talk about the beautiful Kobe and Gigi Memorial that was held in Los Angeles on February 24th. It took my breath away over and over again. Here are some of the highlights from the event. This one, Kobe, take care of our Gigi. I've got Natalia, Bianca, and Capri. We're still the best team. Here's some of Vanessa Bryant's speech.
God knew they couldn't be on this earth without each other. He had to bring them home to heaven together. Babe, you take care of our Gigi. And I got Nani, Bibi, and Coco. We're still the best team.
And then we go to this right here, and I'll let Beyonce do the talking.
Baby, kiss me. Before they turn the lights out. I'm here because I love Kobe, and this was one of his favorite songs.
So it just goes on and on with tributes like this to Kobe and to Gigi. This one's from Michael Jordan. It says, only Michael Jordan can make the world laugh during this moment. This man is truly the greatest of all time.
Now he's got me. I'll have to look at another crime meme for the next.
It really was a great moment. And just here's an overall look of the memorial. How gorgeous it was. Gianna would have been an amazing mommy. Vanessa Bryant says of her daughter, she likely would have become the best player in the WNBA. And then there's this picture. Best assist of Michael Jordan's life, taking Vanessa off the stage, or escorting her off the stage. I thought it was just such a beautiful memorial. I had this conversation with you guys yesterday. I grew up loving the NBA during Michael Jordan, Charles Barkley, that era. I feel like with the Kobe Bryant era, I got out of it, and I wasn't really into the NBA, and I feel like I missed out on this amazing player, this amazing human being, learning more about him, and it kind of makes me sad that I missed out on this legacy, and I'm hearing about all the wonderful things he did for people, and I missed it. How do you feel, Deja, about the memorial and everything?
I'm kind of in the same boat as you as far as Kobe. I've never been a big sports fan, unfortunately. But once he passed away, just seeing the impact that his death had on so many people was very, it was mind-blowing to me.
Yeah.
So just looking into some of the things that he did, he really was an awesome player. Now, the memorial, I didn't watch it all the way through because I couldn't. It was very emotional for me.
Yeah.
I came in right on the part when Vanessa was giving her her speech, and I started tearing up. I was like, I gotta change the channel. I can't.
Yeah, I cried a lot, and not just like a glistening tear, like crying at my desk, couldn't hold it together. It was beautiful. Jen?
I think it's really amazing that Vanessa Bryant did this. They said that she was so integrally involved with everything, and in her grief, she didn't have to do something like that for his fans and for the public. And I think it's really fitting for him to have that kind of send-off to talk about the impact that he had on the world. And I think it's all any of us can hope for, to have that kind of impact on the world. I mean, that's amazing, but it was just absolutely heartbreaking to see the pain that everyone was in.
I think you're right. I think a lot of people, when you have such a tragedy where someone loses their husband and their daughter, there is a sense that you want to protect Vanessa, but at the same time, you want to hear from her, because there's a piece of you that I just want to know you're okay. I want to hear some sort of strength in your voice. I want to hear that you're okay. And I think that's, for me, when she got up there, it was like, okay, look at what she's doing. Look at how strong she is. This is truly amazing.
Yeah, I mean, I love basketball. It's my favorite sport. I pretend to play it in my free time, not well.
And get injured.
I get injured a lot. But, for me, it's just nice hearing all the stories. You get to hear the behind-the-scenes stories, and seeing Michael Jordan, who, when he's a player, that guy's an assassin, man. He did not show any emotion, and then for him to be up there crying, it's pretty incredible, because he's like a rock, that dude. And then the other story that I liked was the story Shaq told,
Oh, yeah.
which I'll clean up a little bit, but he basically said he gained respect for Kobe because the other guys on the team were complaining that Kobe was taking a lot of shots, which, yeah, Kobe took a lot of shots. And so Shaq said, he went and talked to him in his Shaq voice. It was like, Kobe, you're taking too many shots. And he's like, there's no I in team. And Kobe says, yeah, but there damn sure is a me, So, and he's like, he got his respect. And so that's the Mamba mentality. That's the Kobe way to go about it.
And it was pretty crazy, right? Like, Michael Jordan doesn't really take on a public life too much these days, right? So it was pretty impactful that he was not only there, but spoke with such emotion.
And I have already seen some just memes that have come out of him crying already, just playing off of it. So it was a beautiful, beautiful tribute and memorial for all of the passengers involved, especially Kobe and Gigi. All right, guys, finally a topic that's got me confused. A man on an American Airlines flight repeatedly hit the back of a woman's chair after she reclined it. I have so many thoughts on this, so let's take a look at what I'm talking about if you haven't seen it.
When Wendy Williams reclined her seat on an American Airlines flight, she had little idea of the trouble that was in store. She says she was flying back from a teachers' convention when the man sitting behind her asked if she would return her seat forward while he ate his meal. Williams says she did, and that she reclined it again only when he was finished eating. But Williams says the man started punching her seat repeatedly.
Okay, so you get the gist of this. I just can't. So here we go. Wendy Williams is the person who should be sued. She has no right to complain about knowingly, purposefully injuring another person's kneecaps. Amazing. Okay, then you have a different response, like this guy. This woman, I'm sorry. He should be arrested. Clearly a misogynist who supports the patriarchy. And then with this one, this incident is the airline's fault. They keep squeezing passengers into smaller and smaller spaces. If reclining your seat makes the person behind you feel discomfort, that is the airline's fault. I will continue to recline without asking. This person says it's not a debate on etiquette. This is outright harassment and provocation of assault against women. If this was a 6-foot guy sitting in front of this obnoxious beast instead of this patient lady, he wouldn't have gotten that far. I don't understand how we are having a discussion that this guy is in any way, shape, or form correct for doing what he did. It's just my thing. airline seats recline, and they recline this much. So I don't understand how he can be so mad from losing this much space. He's also in the back. His seat does not recline, but you know that going in on American Airlines. You're assigned seats, correct? So I'm having a really hard time with people not being on her side. What do you think?
Okay, so I'm that person who I didn't even know it was considered plain etiquette
Oh, yeah.
not to recline your chair, or not to be reclining your chair, because I'm taking full advantage of all the amenities that I have in my little middle class.
Yeah, exactly. I probably cost you $800.
in her looking at her perspective, I'm someone who picks and chooses my battles. I don't know if I would have continued to, I would have just
moved up eventually.
moved up. Because I'm like, who wants to be punched in the back? Like, if it bothers you that much, I'm just gonna.
But the flight attendants did not put a stop to this, or they just said, move your seat up. And I don't understand how anybody says it's okay. But Jen, I know you feel differently.
Yeah, I mean, I saw online, it's a contentious issue.
It
and
is.
It's pretty 50-50 on whether people recline or they don't recline. I fall into the do not recline camp. I would never recline my seat. And I do stand by. It is annoying. I fly with my small children all the time. It's hard to get under there and get into your carry-on. And it's 3 inches. Like, is it really going to make a difference for the comfort of your flight? So I stand by my no recline policy.
So would you recline, though, if you asked the person behind you?
I don't think I would ever engage, because you got to be in a tight space, and it's just kind of not my style to want to engage if they got mad, because you'd be stuck with them the whole time. So I just feel like, I'll just stay up here, you stay back there, we'll be all good.
Right. Chase?
I mean, I think when I first watched this, my 2 daughters, who are 10 and 13, one of them was actually poking the other one constantly, going like, stop hitting yourself, stop hitting yourself. I was like watching this, I'm like, these people are so juvenile right here, like
True.
both
this
of them.
is what society has come down to.
Like, the guy won't stop punching her seat, she won't recline, neither one's talking to each other, she's filming it. You know, it just blows me away. You know, when you get on an airplane, nobody wants to be in the economy class on an airplane.
Right.
I've never actually flown first class, and maybe that's a different experience.
I have not either.
But when you're on an airplane,
How good could it be?
Yeah.
On a plane?
Well, they give free champagne for what I hear. So I don't
When you're on an airplane, you're in survival mode. And for me, when I go in there, I know it's not going to be a fun day, especially with my kids. But, you know, I try to be polite and nice to everybody in the hopes that they'll be nice to me, you know? So I don't know why people can't just be nice to each other.
Yeah, I do wish that they had just some sort of conversation, like how much more in the flight can I, I don't know. It was very, very juvenile what was going on. She is actually claiming that she has having neck problems and back problems because he supposedly punched the seat very, very hard a couple times before he started doing that tapping. And she got out the phone and attempts to try to stop him.
I think Jen was sitting next to him and she punched the seat. She's against that.
Yeah, that's me being crazy again.
It's just amazing where social media takes things. And do you ever feel, because you are an influencer and because you're out there, you have to be careful about what you post and what you don't post and where it's going?
Absolutely, because I know that for me, I don't post without a purpose. So I make sure that whatever I'm posting, whoever I'm supporting, whatever I'm viewing or whatever the case is, or reposting aligns with what I want people to take away from who I am. So
That's our good takeaway for the day.
Thank you. Be nice and think before you share.
Yes.
Great advice.
Definitely.
Thank you so much for being here.
Thank you for having me again.
All right, guys, a few minutes ago we talked about the coronavirus. We're going to continue this discussion with a doctor from the Southern Nevada Health District who talks to us about how Southern Nevada is taking precautions. We'll be right back.
Caring for a family member can be challenging and lead to countless questions for them and for you. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Well, there are so many questions surrounding the coronavirus. I'm so thankful we have Southern Nevada Health District Medical Investigator Dr. Whit Crosshauer to help answer some of these questions. You guys are busy, I'm assuming, with coronavirus and figuring out what's going on and potential threat to Southern Nevada. What's going on with the office right now?
Well, yeah, it's been a busy last few weeks for the entire world, for the CDC, and for state and local health departments. But yeah, there's a lot of new information coming out. There's a lot of misinformation going around. So thank you so much for having me here to help educate people.
Absolutely. So let's talk about coronavirus, this strain specifically. This is a new strain. What kind of symptoms does it produce? What happens with this coronavirus that you know so far?
So before I get into the symptoms, I want to discuss that coronavirus is a large family of viruses. There are 4 other coronavirus species that cause basically common cold symptoms. The SARS-CoV, so SARS coronavirus, is one that people were familiar with that caused pretty severe symptoms. MERS, Middle East Respiratory Syndrome coronavirus, was another one with pretty severe symptoms. And now we have this brand new one, which is called SARS-CoV-2, and the disease that is caused by it is COVID-19.
Okay.
So a lot of information going around. But basically the symptoms there's a broad range of symptoms. Can be anything from, people can be asymptomatic, so no symptoms at all, or very mild symptoms like cold-like symptoms, to severe symptoms, pneumonia or even death.
If this is, it can cause pneumonia, or some people don't have symptoms at all, why are so many people dying from this? I mean, I guess I'm trying to make that link. What makes this so fearful? I mean, we have the flu all the time, and the flu can kill as well.
I think the biggest thing that's causing fear about this virus is that it's a new virus. So previous to, December of last year, we hadn't seen this virus in people at all. So it just was an unknown virus. And whenever we have a new infectious disease, a new virus, a lot of the fear is that we just don't know that much about it. Now, a couple months in, we know a lot more than we used to know. So we're seeing that it can have very severe symptoms. It can lead to death, but in a much smaller percentage than, for example, for SARS or Middle East Respiratory Syndrome. One of the things that is still kind of unknown is how lethal it is. So, for example, if you look at the reports of the number of deaths and the reports of number of cases worldwide, the percentage of people who get it and then die is something around like 2%.
Oh, okay.
Yeah, so it's pretty high. But I think what is a higher probability is that there are a lot more people who, for example, in China, who may have the disease, they may not have symptoms, may not ever get tested. And so the percentage of people who are dying from this is probably smaller than what's being reported. So that's both good news and bad news. The good news is that if you get it, the chances of you dying from it are small. The bad news is that when people are asymptomatic or they have very mild symptoms, they may never think to go to their doctor, they may never get tested, they may not get isolated from other people, and so the chances of it spreading are greater. And so that's what we're really seeing in China and around the world.
It's really interesting. It's good to hear that your chances of survival are far greater than actual death. But one of the things that always concerns me, and I've always been impressed with Southern Nevada Health District, is we have so many tourists that come to our wonderful city. And now you're saying some of them might not have symptoms. I mean, is there a chance? I know that are they limiting flights or coming in, or people who can come in, but could it already be here? Could it have already been here in people who weren't experiencing symptoms? Is that something you all are looking into?
Well, there was President Trump made a presidential proclamation stating that, or limiting the number of people coming basically from China and some other affected areas. And so basically what that did was it blunted the number of new travelers we had here, people who were potentially exposed. So that probably has limited the number of people coming here. We are also getting continuous updates from CDC, the Division of Global Migration and Quarantine. So if U.S. citizens have been in China and then they travel back to Nevada, they get routed through one of like 11 airports that have quarantine facilities. Even if they were to have the disease, it would limit the contact with others. But we don't think that's what's going on right now. There's no evidence that there's community transmission of this virus in the United States, and certainly no evidence of it in Nevada.
What about testing? I know that the White House just asked for $2.5 billion, some of that for emergency kits, for vaccine, for the making of vaccine. Are these emergency kits to test for coronavirus? Are they just so expensive? Do we even have them in Nevada? How does that work?
Well, the reason why it's taken a while to roll this out is because this is a brand new virus. So I think this basically has happened at an unprecedented pace where the virus came out. They figured out what exactly is the sequence of the virus. That information was shared internationally by the Chinese researchers. And then CDC and other organizations have created tests for them. And the CDC is in the process of pushing out these tests to other health departments. It's still in process. Here in Southern Nevada, we currently do not have the capability to test for novel coronavirus. So if we were to identify anyone under investigation for coronavirus, we would basically take the samples and send them to the CDC for testing.
Oh, wow.
In the future, we will have that capacity, and the CDC will be sort of like a backup to do confirmation testing. But because this is new, it's not something that's commercially available. Hopefully that'll happen in the future, but we're not there yet.
Do we know enough about the virus yet for its lifespan? Is this something that, with the flu, we have our flu season. We know when it's coming. We know when it's hopefully going. Approximation. Do we have any sort of timeline for coronavirus?
There are a lot of sort of buzzwords going on right now. There's epidemic, there's pandemic. So epidemic basically means, we have a spread of this disease in like specific, isolated geographic regions. Pandemic would mean that we have this disease, this new disease that can cause illness that's spreading sort of around the globe. And we're not at that pandemic level yet. The word pandemic doesn't indicate severity of the disease, so just because...
It sounds bad, though.
It sounds bad, but if WHO declares that there's a pandemic, it doesn't really mean anything about how severe the illness is. It just basically means that we're seeing spread out in the community and in geographic regions across the world. But so, we can't say the flu is endemic. So basically, it's always here. It gets worse in the flu season, and it sort of cycles between the north and the south hemispheres, southern hemispheres, and something that we just associate with normal life. A lot more people die of the flu every year than have died of coronavirus, which is not to downplay the severity of coronavirus. It's just to say that that is a disease that we feel comfortable with. A lot of people take it for granted that there's the flu. They don't get the flu shots. They go to work even when they think they might have the flu. So, one of the big messages we're trying to get out is a lot of those same practices that you use to protect yourself from the flu will protect you from the coronavirus. So, frequent hand washing, it doesn't just count if you just run your hands under the running water for 2 seconds, 20 seconds, soap and water. If you don't have access to that, then using alcohol-based hand sanitizer, at least 60% alcohol.
Okay.
Making sure that if you are sick, staying at home so you don't get your coworkers sick. So a lot of those same instructions we give for the flu are really the most helpful things for this new disease.
Okay, really quickly before I let you go, how many cases, do we have any corona cases in Southern Nevada right now?
We have no confirmed cases of coronavirus in Nevada.
Okay, well thank you so much, Doctor. We really appreciate all the information you've given us.
You're welcome, thank you.
All right, guys, and thank you at home for watching. Remember, you can get in on the conversation. Just follow us at City of Las Vegas and use the hashtag TrendingVegas. You can also find us on YouTube, Apple TV, Roku, and Amazon. Have a great day, everyone. We'll see you next time.